Welcome to my third episode of the podcast. Today we are talking about contraceptives, STIs, and health clinic resources with two doctors from Columbus. And we will also be touching on questions of anonymity with reaching out with insurance for these resources and further questions along those lines. So I hope you enjoy. Thank you so much for watching.
Sure.
But I think a good way to start would be introducing your guys's yourselves, and then also maybe talking about work experience, if that's okay.
Sure. Okay.
So whoever wants to go first.
I'm Dr. Jen Hartwell. I'm a pediatrician here in Columbus, Indiana. I did my medical school training at IU, and I did my residency in pediatrics at the University of Wisconsin in Madison, Wisconsin. And then I've been in practice, it'll be 10 years in August. So I see age groups from newborns all the way to 19-ish. We usually see kids through their first year of college. So so that's kind of my daily, I full-time in the office. So I'm seeing patients 4 days a week, roughly 15 to 20 patients a day in those age groups. So a handful of teenagers most days as well. So
Cool.
And I'm Dr. Amy Hale, actually born and raised here in Columbus. And I've been back, I guess, about 5 years now. I came back to work here at the hospital. I was trained in family medicine, and I also went to Indiana University for my medical school and actually did a rotation with Dr. Hartwell years ago. Seems like it wasn't that long, and yet it was. It was.
Yeah.
And then residency at St. Francis in Greenwood. So have been back for 5 years. And even though I was trained in family medicine, right now, like we were talking about earlier, I'm just seeing adult patients. So I just don't have as much time spent in, I'm just not doing adolescent health anymore. So, but this was a good refresher to kind of look, I appreciate the questions you sent, and I think this is a great project.
Awesome. Thank you so much. So I guess let's just jump right into it. I wanted to talk about contraceptives and just kind of talk about like what you guys promote to your patients, kids, honestly, and talk about, I guess, the success rates or failure rates, if that's necessary. Like, I know a lot of people who use the pill as their form of medication, and I don't really, what does that consist of for patients, like when they use those?
Yeah. So there are really two reasons that we give adolescents what we call birth control. One might be because they are sexually active and they need to prevent pregnancy. We also use birth control of various types for regulated menses. So some women who have irregular cycles or heavy bleeding may benefit from the oral contraception simply because they're hormones, and those hormones help regulate the cycle so that they can have lighter periods, less heavy periods, less length of periods, and more regular cycles, so they can predict when their period's going to come. So, but when you look at it as a contraception rate or contraception, the oral hormonal birth control pills are, I think, 99-ish% effective if you take them correctly, which can be a big challenge for teens, probably even adult women.
And I was wondering, sorry to cut in.
Go ahead.
I know that there's like a lot of, I take the pill for acne regulation, and I know there's like a lot of people say like you have to take it at the same time every single day, or else like it doesn't work, or it's like
I think it's most effective if taken at the same time every day in a perfect world. So I was sort of reading up on this earlier today. I think, typical use, it does tend to be probably less effective than some of the other, types of contraception in terms of pregnancy prevention, just because in the real world, people don't remember to take a pill at the same time every day, or they get sick and they, have vomiting, or they're on an antibiotic or, something. So those usually, I think it's because the method is just not always able to be used correctly.
So it's definitely more falls on human error of taking the medication versus it just not being effective.
Right. And I tell my team, as long as you're taking it around the same time each day, like whether it's at breakfast or dinner or bedtime, but you don't want to take it at breakfast one morning and at bedtime the next day, because now you've got hours in there. So anything that breaks that sort of cycle of hormone balance can then make the body say, oh, no more hormones, less. So the way that hormonal birth control works is that it sort of tricks the body into thinking there's already an active pregnancy, right? So the progesterone in the pill, progesterone is made by the uterus and a fetus. So if the body sees a high level of progesterone, it thinks there's an active pregnancy. So you didn't want to release another follicle because you don't want to see pregnancy, right? So that's sort of how, in layman's terms, how the birth control pill keeps you from getting pregnant, is that you're simply not ovulating.
Yeah. And
without ovulation, you don't have the cramping and the heavy bleeding that you would have with a period. So that's why the periods are often lighter and less symptomatic. So
cool. So some people take them, I mean, not even just for birth control reasons, but just for I guess regulation of hormones, like I said, like acne, and also maintaining periods.
Correct. Yeah. Yeah. We have a lot of teens who, their periods did not regulate. Most girls will regulate their period in about 2 years from the start of their period. But if they're not regulating at that time, then a lot of times they want to have some more regularity, because it's just very stressful to not know when your period is starting. So they'll come in about, could I take this? What are the benefits? What are the risks? It can raise your blood pressure. Some women will gain weight on the pill just simply because it's a hormone. And then if you have migraines, those can be worse. So there are some reasons that people might choose not to take it, other than the fact that, you have to remember to take something every day. So as far as birth control, it's probably not your best option. Like Dr. Hale was indicating, is that because if you're not going to take it every day, and a lot of people cannot do that, even adult people, you might want something more that you don't have to think about, right? So that would be an injectable form of birth control, which is progesterone only, and that's Depo-Provera. Okay. That every 12 weeks, you come in and get an injection. It goes into the muscle, and then it slowly releases over time. Or for some of the older teens, we're even starting to offer them the intrauterine device, an IUD. I don't tend to talk about that too much until I'm closer to the 16 to 18-year-olds. It's about at least 5 years of coverage of preventing pregnancy. And it's a small device that goes inside the uterus that inhibits any fertilized egg from implanting into that uterus. So it's a really great form of birth control. It also really downregulates the periods as far as how heavy they are and how often women cycle. And some women will say they don't even have a period when we're on those. So
do they still? Oh, sorry.
Go ahead.
Most of them are not real excited about having something placed inside their uterus, right? It just sounds really scary. But an 18-year-old going to college and definitely doesn't want to get pregnant for 5 years, I think it's a great option. So. And
do they still make I know there's 2 types. They do like a hormonal version, and then there's a copper version. But I heard, I think someone's mom was saying they don't do the copper one anymore for whatever reason. Do they still offer that?
Not that I don't know. I know that my GYNs here in Columbus do the hormonal one. So
okay.
Yeah, I've not seen the Paragard, which is the copper IUD, used in a long time.
Yeah, that's what I thought. Okay, cool. Mm-hmm. And those are like over 99% effective for the.
And I looked this up. I consulted AAFP, the American Academy of Family Physicians, and they list that as one of the most effective. Yeah. Less than 1 pregnancy per 100 women per year. So, and again, you're removing that human error. It's something you don't have to think about, and really generally pretty safe, well tolerated. Although I have seen, and you know what, actually, Dr. Hartwell, you might know this offhand. I'm not sure those are approved. Is there FDA approved down to a certain age, or I'm not sure. I don't see them used as much in younger women, just because it can be putting them in can be kind of uncomfortable too, I think. So
yeah, I have one 17-year-old who got one. I'm not sure if anybody under 16 can get those. I'm not sure what the cutoff is from the manufacturer.
I think that's what we were told in Owl was usually they're not really marketed towards anyone under even 18, I think.
Okay.
But I mean, yeah. And then there's also I know the arm implant is starting to get kind of popular as well too. I'm actually like, I see like I know people who have it and I see it in their arm and I'm like, I don't even know how it gets in there. Like, is it like do you have to go through surgery to get that, or is it?
Yeah, I think they just entered under the sort of subcutaneously under the skin as if
Okay.
we're getting a shot, but it's just directed directly under the skin, almost like someone was putting an IV in you, right? But it doesn't go to your vein, but it goes slightly just right underneath the skin. And I was not trained to put those in as a pediatrician, nor do I put in the IUDs, but I have a few teens who've chosen that. The problem is if you have side effects, then you have to get it removed.
Yeah.
I mean, not that you wouldn't have to remove your IUD, but I think removing those is a little bit more of a ordeal than just having your IUD removed. So
yeah, it can be done in the office, both the insertion and the removal. And actually, I mean, there's a really pretty simple device for insertion. I also have not been trained in that, but I have worked with a nurse practitioner who has, and it's pretty simple. Yeah, but as we've talked about some of the other options, it's probably a little more involved, like Dr. Hartwell said. Yeah.
And then, so I guess to sum it all up, the number one, probably the most effective, but it's probably, and it's most long-term, but it's probably best for older females, is the IUD pretty much.
Like, if you're looking for effective birth control, then yes, your IUD is your best bet. But yeah, I think a lot of teens are still hesitant to think about somebody putting something inside their uterus. And there used to be a lot of negativity around the IUDs because I think there were some people way back when they had the copper ones and some before these nicer ones came out. There were women who would suppose they had scarring in their uterus and then they couldn't get pregnant when they wanted to. And so there was a lot of debate about the safety of these. But I think these newer versions, the GYNs here in Columbus really promote them with their women who are even in between, they had a baby, they don't want one for, a 3-year gap or something like that. It's a great bridge so they don't have to think about birth control over the next 2 to 3 years. And then if they do decide they want to become pregnant before the 5 year, they can just have it removed. But as far as popularity, I think the birth control pill is probably most popular of the teens I take care of. Whether they take it appropriately or not, if they're taking it because they have an irregular period, then I'm not as worried about them missing a pill. I mean, it's not going to make the period regular like they want it if they miss a pill, but preventing pregnancy, if that's your main goal, then you really do want to make sure you're taking it as consistently as possible. So
I should also be noted what I've read about the Nexplanon, the rod that is inserted under the arm is I think that, safety studies were only done in women 18 and older. So I'm not sure that I've seen that used. Dr. Hartwell, have you seen that used younger than 18?
I've had kids in my clinic who've had it. I mean, 16 or 18, but I don't know what version it was. So yeah, maybe there's just a off-label use for younger if they do. So
right.
So I have a question. This came from someone. They wanted to know how they can, if there's a way that they're able to talk to their physician about birth control and possibly get a prescription anonymously without having to involve their parents in that conversation.
Yeah, it probably depends on the age of the patient. So we see a lot of teens, 16, 17, who come in without a parent for their checkup or come in because they have an issue. But, and then if I do a urine test on them to prove they're not pregnant and they want to get the prescription for the pill, I don't have to tell the parent any of those things. Now, obviously, if they have to use the parent's insurance to pick up the pill at the pharmacy, the parent may say, what are you picking up? What prescription did they write for you? But I'm not obligated. I don't have to tell the parent anything about that plan. So it'd really be between the teen and their parent if that parent asked, hey, what are you picking up? They would kind of have to come up with their own answer
Yeah.
to their parent from knowing. But I think there are some teens who will tell their parent, I'm having irregular periods and I'd like to go on the birth control pill. But really, they may actually be sexually active and they want to use it for that reason. And I don't question what they're really getting it for, because I never deny a teenager a birth control, because I think it's if they're sexually active, whether I agree with that or not, or who their partner is, whatever, I just want them to not get pregnant. I mean, that's my and not get a sexually transmitted infection. But if I can prevent a pregnancy and they're telling me that it's because they have heavy periods, but really they're sexually active, but they won't admit that to me. Okay, I just want to make sure that you're covered. So, but as far as whether the parent can find out, my office tells me that the parent doesn't get a bill that says pregnancy test. They just get a lab test, right? That it just says lab test. But I figure a parent is probably going to ask, what is all this about? Whether
I think, oh, sorry, go ahead.
No, go ahead. I'm not telling them, and they can kind of tell the parent whatever they want to tell the parent, because sexual health is a privacy. You have a right to have privacy about your sexual health. I think as young as 14. I can't recall the exact legal number.
I think that's it.
So I can't tell a parent, and even at 13, I probably wouldn't tell a parent, right? Because if they come to me and they need that confidentiality, I want to respect that as much as possible, as long as they're safe. Now, obviously, if they say they're sexually active with an adult person who's 18 and they're 14 or 13, then that's a legal issue, right? That may be reported. But from a privacy standpoint of, am I going to tell your parents that you're asking this question? No. That privacy is or that confidentiality is maintained. So
I know in the past, and Matilda, you may have had some questions about this, and Dr. Hartwell would have more experience, but we would routinely, especially at wellness visits, especially for our adolescent or teenage patients, back when I was in residency, we would ask the parents to leave, because oftentimes parents would just kind of come along, and we just kind of would make that a very, make it just routine, just to allow the patient to have some privacy. I really just think that a good dialogue and rapport with your pediatrician or your primary care physician is so important. And again, as I was trying to read up and prepare for this discussion, there was a lot I found in the literature, actually in the medical literature, about how important just counseling, and that counseling, behavioral counseling, could be just a discussion in the office with your primary care doctor about STIs, about just basic information, or about how to reduce transmission. So I think it's just really important to be able to feel comfortable to talk to your doctor and understand that that's a confidential conversation that you can have. Save some, there may be some legal situations that could come up, but just in general, I think that's really important.
Yeah. I have another question that someone sent in. They asked, I think they were referring to like the prescription birth control. They asked, can you use more than one type of birth control at the same time? So like, I guess like the IUD with the pill, or something like, is that a normal practice, or is that something that people are able to do?
It's not something I think anybody would recommend, because if I knew a kid had an IUD, I wouldn't prescribe them a birth control pill, right? I would say you got to pick one or the other, because if you're taking estrogen you have estrogen or progesterone in your IUD, and now you're taking oral estrogen and progesterone, your levels may get high enough that you could be more susceptible to high blood pressure or migraines, things like that. So I don't think, and it certainly is not going to really up the chances of not getting pregnant, right? It's not worth taking both of those. If you're already at 98% of pregnancy prevention, I don't think you're going to get much higher by doing the method. And I think there's too much risk involved. So it's not common practice, and it would not be recommended, at least not in my, in the pediatric world. Now, does GYN recommend that for some? I can't say for sure, but
I don't see that routinely. The only situation I can think of is, say you're taking a birth control pill and you're on a medication that might render that less effective. I know there's a little bit of debate back and forth about certain antibiotics, and lowering the effectiveness of a oral contraceptive pill. But then, condom use would be maybe something that you would recommend for that brief period of time when you're taking the antibiotic.
Yeah, that's what I was just about to go into was condoms are good for birth control and both STI prevention, although not like 100% effective. They still do greatly reduce transmission between person to person. I think it's like 82% effective when used properly. And I know as a general practice in OWL, they said like even if you're like if you're with a new partner, even if you're using a prescription birth control that is highly effective, like use a condom, not just for pregnancy prevention, but also STI prevention.
Absolutely.
Yeah, so that's the count. When we put on a patient on birth control, whether they say it's for heavy periods or sexual activity, I remind them this protects you from pregnancy, but it does not protect you from gonorrhea, chlamydia, HIV. Yeah. And I often say there are things worse than being pregnant, right? I mean, HIV is a lifelong illness. So if you are with a partner that you don't know their history, and most people would say they probably don't know their partner's history unless you've been in a monogamous relationship for many years. Condoms, we recommend condoms even if you're not on a birth control, and even if you are, to prevent the pregnancy, or you're going to maybe increase your chances of preventing pregnancy a tiny bit more with the condom, but mostly it's for the STI prevention.
Right. We've mostly to this point kind of been focusing more on pregnancy prevention, but yeah, for sure, it's a totally different conversation when you're talking about STIs.
So for I guess now would be a good segue. I kind of wanted to go through and talk about STIs. I felt like that was something that was really brushed over when I went through sex ed in high school. I didn't think we were really able to look at any of like the initial symptoms and just like the whole stigma that comes around with them. I mean, you don't necessarily have to be sexually active. There's mother to fetus transmission, and even like you don't have to necessarily have sex to get an STI. It can come from touching and just like skin to skin contact. Is that true?
Very true. Yes. So go ahead.
I was just going to say, like, so that would pertain mostly to HPV and herpes, and there's a difference between those two, which is kind of foggy between me. So I'd like to personally ask, like, how you can differentiate those two, because I think it gets mixed up a lot.
Yep. So I would say the main sexually transmitted infections that we focus on in the pediatric world are gonorrhea and chlamydia, which are often asymptomatic in men and women. And those are best prevented by condom. And I would say you could probably get those. You don't have to have, vaginal intercourse. You could have anal intercourse, oral sex, heavy petting, whatever you want to call it, right? Mucous membranes, it's going to spread those those infections. And then you have your HPV, which is the human papillomavirus, and that's more of in the wart family. So you may have heard of genital warts. It also can cause cancer. So that's the HPV. So those lesions would look more like a wart, like you might have a wart on your finger. You'd see those same lesions, wart-like lesions on the rectum or on the vaginal area or on the penis. And then herpes is more of a blister. So that's herpes simplex virus. So that's, people get cold sores. That's one type of herpes simplex virus, but then there's another type that tends to infect the genital area, although I think there's a lot of cross between one and two.
Crossover, yeah.
But those tend to be more of a blister or an ulceration on the vaginal area or the penis. So if you're looking for an outward sign, it'd be blister versus wart on the HPV versus the herpes simplex. If you're thinking about gonorrhea, chlamydia, that would be most common symptom would be like dysuria or some discharge that was not your normal color of discharge.
Dysuria meaning burning with urination.
Yeah, sorry.
Clear that.
Sorry about that.
No, it's okay. I'm in med terms. I understood what you meant. I wasn't even thinking about it. But then I was like, hey, I'm having other people listen to this.
And for now I lost my train of thought.
Pelvic pain.
Yeah,
or
so
often, as you pointed out, no symptoms at all for
So
some people. So
to some sort of burning when you pee or discharge, all the way to pelvic inflammatory disease, which is where the uterus has become inflamed and is very irritated. And those women are in a lot of abdominal pain. I haven't seen a ton of that in the pediatric world, but when I was training in a med school, there were a lot of adult women who would come in with pelvic inflammatory disease from probably untreated gonorrhea or chlamydia that they had just either ignored the symptoms, or, just some people are just more susceptible to it getting higher up in the tract and then causing those problems. So
this was more of an obscure question, but just as a little bit of a side note, I know the Gardasil vaccine has been like really heavily promoted, especially to teens my age. And someone asked if the Gardasil vaccine prevents HPV totally, or if that's like, I think it doesn't prevent HPV completely. Doesn't it just
high risk strain?
Yeah, it's with the progression to like a cancer.
Well, yes, it prevents you from getting the serotype. So HPV, there are lots of types of HPV, like lots of bunch of numbers, right?
Mm-hmm.
And then there are, well, at least they used to think there were 2, and then they thought there were 4, and now there are 9 types that are covered in the vaccine. And those 9 types are the types that have been found in either head and neck cancers or cervical cancers or rectal penile cancers. So that's why those were added to the vaccine, because you want to prevent that virus from becoming part of your cell. So if you have the vaccine, then even if you get introduced to that virus, your body's more likely to clear it. We know that some women or men will clear HPV even without the vaccine, but the chances of that can be very low, and we don't know who can do that better than someone else. So getting the vaccine allows you to protect yourself from getting the virus and keeping it in your body long enough for it to become a cancer. So I wouldn't say it's 100% but I don't actually know the numbers off the top of my head. But I just saw an article today that the cervical cancer, HPV infections are way down because we've been so aggressive at getting people to get the vaccine.
That's awesome.
Mm-hmm. So we still have some work to be done. Indiana is still not very high in the coverage with that vaccine, especially getting a second dose. So there's 2 doses or sometimes even 3 doses that are needed. And you might talk a teen or a parent into 1 dose, and then they kind of get lost to follow up and they don't that second dose, and then they're not as fully protected. So
we've done some catching up. Actually, since I see older patients, that we've had some who are kind of in that window where we can still do the catching up, but it's really most effective, I think, if it's given before onset of sexual activity. So I think it's started, Dr. Hartwell, correct me, age 9 for both girls and boys. Is that correct? Yeah. And then 2 doses if you're under 15, and then you need 3 if you start it after age 15.
That is correct.
So, yeah. Okay. Yeah. Highly recommend to anyone listening to this, get your HPV shots, please.
I remember. Go ahead.
There is still a lot of stigma around this vaccine because parents have to choose for their children to get this, because anybody under 18 cannot make that executive decision if their parent says no. And I think a lot of parents see that as a sexually active vaccine, like, my kids don't need that. They're not sexually active. And then all of a sudden the teen's sexually active and the parent thought they weren't, and now they've kind of missed their window to get that. So, and Amy's right. We do try to get parents to step out of the room and have a conversation with them. Some parents are more hesitant at that at younger ages. So you kind of have to, know your audience, but by 16 for sure, I want the parent out. And many times I don't let it be optional at that point, but at 14, sometimes they're like, no, we talk about everything together. It's fine. So I still go through my questions, knowing that I'm probably not going to get accurate answers, but at least that lets the parent know this is why I need to talk to your child alone, because these are the questions I ask about smoking, alcohol use, tobacco use, vaping, and drug use, and then sexual activity. So there's no way a kid is going to be honest, and a parent sitting right there for the most part. So during that time, I kick the parent out of the room. I also go through, here's why I want you to know about HPV, because your mom or parent doesn't want you to get this right now. When you turn 18, you get to decide. And I want you to be thinking about that, so that if your parent still does not authorize it before you turn 18, when you turn 18, you can say, I'm getting it now because this is why I want you to get it. And so, but again, if they start at 18, they've got 3 doses to catch up on, and they may have already become active. So it could be a bit of a game.
So for treatment, I know I always hear that herpes, there is no cure. Technically, there's just moments where it sometimes lies dormant and sometimes it expresses itself. And is HPV that same way?
Women can certainly have HPV for a long time and not know it. And it's not something that we would routinely screen for in adolescent women or teenagers. In fact, pap smears aren't recommended for screening until age 21, even though you'll sometimes still see that being done inappropriately, but 21. And age 30 is when we would start. There is one option at age 30 for women to start doing pap smears and doing co-testing with the HPV testing for those high-risk strains. I've also seen some newer recommendations on simply, cervical cancer screening using just an HPV test starting at age 25, but that's kind of I think that's sort of out of the range for the age group we're talking about. So you probably wouldn't be doing any pap smears in your office at all.
No.
Yeah. So
try not.
Yeah. So, I really think that the emphasis obviously STI prevention, so important. But I get a lot of older women who really stress about this one. Like they're super worried that, when they find out that they're HPV positive, obviously later on, they think that means, they're going to die or, and it certainly doesn't mean that. And like Dr. Hartwell pointed out, this, some women will clear the virus on their own. That's why we are encouraging vaccination for, young men and women, because that's another way to protect yourself. Obviously condoms don't provide 100%, there still could be like some skin to skin contact. But yeah, I just recommend kind of the basic same precautions that we would say to anyone, but there's no, screening we would recommend without any symptoms. And same thing with herpes. In fact, I don't think screening is really recommended unless there are symptoms. So, and we can treat women if the woman finds out she has genital herpes, we can treat flares as they happen, or some women will have frequent flares. And so we can put them on like a suppressive regimen where they'll be taking the antiviral medication daily, which is not everyone wants to do that, but some people do.
Is there any other, we didn't really talk about HIV, but that's kind of the big one is absolutely, I know everyone's just like, everyone thinks it's a death sentence, which isn't necessarily true anymore. But
correct.
It definitely.
Oh, go ahead.
Oh, no,
sorry.
I just was gonna say it definitely is a lifelong. I don't want to say experience, but it is like you do have to deal with that for a lifetime. But go ahead. What were you gonna say?
Well, I think it's essentially become a chronic disease, but it's a chronic disease that needs to be managed lifelong with medication, and that's asking a lot of someone. So best not to get infected with HIV at all. I was going to point out that the U.S. Preventative Services Task Force actually is recommending HIV screening even in patients with 0 risk factors. Interestingly, I think down to even age 15.
Wow.
So I don't know, Dr. Hartwell, are you talking to your younger patients about this, or is it showing up in your health maintenance that it should be done?
I think it shows up. I'm trying to remember if I think it's 16 or 18. I can't remember where it pops up on our system, but
yeah,
I know that there is some talk about, 16 and up. It's a hard conversation to have because most kids don't want to think about that. So, but if they come in and they say, I had an experience, I had a one night stand, I want to get tested for gonorrhea, chlamydia, I say, well, then great. I'm glad you're, fessing up to this, but we also have HIV on there. Now, if I have a patient, this probably is, will change over the next several years, but right now, anybody who's sexually active gets a gonorrhea and chlamydia test. It's a urine test. That's once a year if you're sexually active. If you change partners, then it's each time you change partners, you need to have a new test. So if you're consistent with your same partner, then each year you get tested. And the reason that is because you don't know what your partner's doing when you're not there, right? So that partner could be bringing something to you. Now, maybe the recommendation will become every 6 months, even if you're with the same partner. Right now, I think it's once a year. But if they have a new partner, then there's a new test each time they have a new partner and are presenting for care. The problem is they don't, it's so asymptomatic that they don't often come in and say, hey, I'm having this symptom. I think I ought to be tested. It's really trying to get that history from the patient to know that they do fall in the high risk category. But because we can do the gonorrhea chlamydia with a urine test and the HIV is a blood draw, it's much more difficult, even if you order it, them to actually go and complete the test. So it's been a bit challenging now. I suspect at some point there may be some sort of tabletop or a benchtop test because HIV, the recommendations are to screen everybody at least once in their adolescent time or in their or in their early 20s, that maybe there's some development coming with that, which would be great because then you could do it more easily. But and that testing also, is confidential to the parent. We don't, we call the teen directly if they have a positive test or even if they have a negative test to let them know the results, and then they can come in and be treated at our office. We sometimes it's a injection of a medicine. There are sometimes they just take a pill. It's a fairly
you're talking about gonorrhea and chlamydia.
Yes. Sorry, not HIV. Yeah, gonorrhea, chlamydia, very easy regimen to complete, and we try to get the teens to come to our office and do that just so we can verify they're taking it. But their partner also needs to be treated because otherwise they will just get that back from their partner again, and that's been a trickier part. There is some legislation out now that says I'm allowed to treat that patient's partner because I'm protecting my patient by treating that partner. But getting that to happen there's some, obviously that person you have to get that person's name and date of birth and send the script, and they have to go pick it up and they have to take it. And, it's a lot of steps involved. And sometimes people don't want to tell their partner they were tested positive because they don't want their partner to know that, but it's really important for their partner to know.
Well, I wanted to point out too that those are reportable diseases. So those are automatically cases, gonorrhea and chlamydia cases are automatically sent to the local or state health department. And the health department will contact, I always try to also preempt that if I have a patient that we're testing, that they will be contacted by the health department if their test is positive. And then the health department can do some anonymous tracing and contact that partner. And there are people who are trained in this. They are, they're really good at protecting the person who's tested positive, protecting their anonymity. So I think that can be something that's a little bit scary to, oh no, why is the health department calling me? But that's routine. That's normal. It's
right.
good.
I had no idea that they did that. That's really cool. Well, that's very resourceful.
Yeah, there are certain, there are a whole list of reportable diseases. Now, I don't think, Dr. Hartwell could maybe tell me this, but I don't think that the age, I would assume like a 17-year-old or a 16-year-old, the health department would still contact directly. I would assume, I think so.
I don't know. I would assume that they would have to call our office to get that contact info, or else they call the parent and say, I need to speak to your child, but I can't imagine they would do that because that would be
at the hospital. And I think I would assume in the, it would depend on your practice, but right. I know if you're a part of like a larger hospital, there's usually a designated person who does that reporting. So we have a pharmacist, like an infectious disease pharmacist, who's responsible for reporting, gonorrhea, chlamydia cases, hepatitis C, HIV. Those things get reported to the health department, and they kind of handle all that. So we're a little bit removed from it, and I think they're just able to pull up all the information and access the chart. But it would depend on your, where. I don't know how that works. Say if you were going to Planned Parenthood, or if you went somewhere else, I would assume it's the same. And I just guess they would have a different way of reporting it, but I would assume you would still be contacted, because it's public health. It's for the good of all of us. And, obviously in pregnancy, and we talked about pelvic inflammatory disease. I mean, there can be lifelong consequences of this stuff not getting treated. So it's just really, really important. Yeah.
Because I know with it's chlamydia, and even I don't know, I know for sure chlamydia, like if that's left untreated for so long, that can lead to like sterility and not being able to get pregnant. So even though it doesn't have very many severe consequences at the beginning, it definitely can come back to bite you in the butt, I guess. Later on.
For sure. Yeah. Very true.
But I guess now would be a good time to ask, someone wanted to know, how should I talk to my partner if I want to get tested for STIs or have them get tested as well? Like, I mean, that was maybe more of like a personality question.
Yeah, that's a tough one. But again, I just think, open and honest conversation is really important. And, people have to be selfish. It's your health, it's your body, you're the person who knows how to protect it best. And I just think it's really important to be able to have those conversations with your partner, with your doctor, with a friend or someone who you trust, and know where to go to get good information that's accurate and, evidence-based. But, you're right. I don't have a perfect answer for that, but I hope that, people can feel empowered to kind of step up and take control of their own bodies and their own health, because it's important.
Yeah. I would say start by getting yourself tested, and then you tell your partner, my doctor recommended I get tested. You don't have to say whether you're positive or negative, because obviously if you're positive, you need to tell that partner. But my doctor recommended I get tested. And I couldn't believe the things that, that they told me, that you can have asymptomatic disease, and we really need to protect ourselves, and, kind of try to sell it as this is what I did to help myself, and I need you to do that in respect for me, and try, like Dr. Hale was saying, that you should be able to expect that from a partner who cares about you. So, but asking your partner to get tested when you're not being tested is, I think you got to start with yourself and say, my doctor said I needed to get tested. I did that today while I was in clinic. They also said it'd be important for you to get tested. So let's see if we can get you hooked up with your doctor. And then, obviously if they're not willing to do that, maybe it's not the right relationship for you, if they're not willing to respect your health in that way. But it's hard when you're a teen to have those conversations. I agree.
Yeah, but you make really good points. And I was also going to say that there are lots of places where you can go to get tested too. I mean, I think a lot of people might say, I don't have a doctor, I don't know where to go. We hear that a lot from patients that we see in my clinic. But the health department is always a good place to start. Sorry.
Oh, no, sorry.
I was going to say, I think depending on the clinic, there may, they would see a person even regardless of their ability to pay. So that's one resource, and Planned Parenthood would be a resource, as well. So just, making sure people know where to go.
Yeah, that's what I want to just get into right now. I know Clarity, I just did my own research. I think they do a full screening for everything, including HIV, and it's around $25. But if you just get, I think gonorrhea, chlamydia, and then HPV and herpes, those are all the basic tests that they offer for free. And I think it's completely confidential, and there's no health insurance needed for that. And then there's also, your family doctor. How do people navigate that with their parents? I know you said whenever you do pregnancy tests, it just comes up as a lab. Is that the same for STI testing?
That's what I'm told. I haven't looked at that myself, but I'm told that even on that benefits or on the bill that you get from the hospital, just say lab tests. Now that, I always tell the teen, it's not going to say I did a gonorrhea test, but when it says I did a lab test, they may ask you what that is. And here's what I tell them is, you tell your mom that Dr. Hartwell tests all her teens for test gonorrhea and chlamydia, even if they're not active. So even though there are a lot of kids who say they're not active at 14 and 15, and do I test them? No. But that teen's mom doesn't necessarily have to know that, right? Because if that teen really is fearful that their parent's going to find out that they're sexually active and there's going to be some harm to them or some, consequence, then well, Dr. Hartwell recommended this test. She says she tests all our teens, so I just feed in the cup. I don't know why she was picking on, because I don't want the parent to think I judge their teen, right? Oh, you look like you might be sexually active, so I'm going to make you pee in a cup. But this girl over here who's on the volleyball team, I'm not going to make her pee in a cup, right? So I try to be as neutral as possible. And that's why I tell the teens, if your parents question this, you just tell them that Dr. Hartwell said it was important and really encourage you to do it. And she has all her teens get these tests. So then they can kind of feel they're off the hook by saying, that's just the standard of care, mom. She does it for everybody.
And we have a whole initiative in our clinic, even though we're not seeing adolescent patients specifically, but we have a whole initiative called We Ask Everyone. We made buttons, we have posters, and it's really just to emphasize that this is just these screenings that may have some stigma attached to them, are really routine. They're important. And, interestingly, a lot of screenings like for HIV are recommended even if you have no risk factors at all. So you should get tested at least once in your life. So I think kind of trying to normalize it, to talk about it, just for us to bring it up. I think it's really important for us to bring it up and to sort of try to reduce that stigma is helpful. But I know there's still a lot of fear and hesitation. So I think it's important for teens to know places that they can go if they're not comfortable talking to their doctor. I just want them to get the screening and the treatment, that's the most important thing. And again, we talked about Clarity Clinic, and you've done some research in terms of cost, and they're not, billing insurance. I know they have some other resources there too, in terms of counseling and things, and Planned Parenthood. I don't think they would be billing, and I don't know about like price. I don't think anybody would be turned away if they couldn't pay.
No, and Planned Parenthood, we were, it's hard to tell with cost necessarily. I know it's free or reduced is usually what they say, because without insurance, if you do use insurance, I think that's a bit of a different route. But Planned Parenthood, you don't need insurance, completely free, or not, it's not completely free, but it's completely anonymous and confidential with, I think they do testing and treatment. I don't know about treatment at Clarity. I just know that they do testing. And then
I don't know about treatment either. I would assume if they're doing testing, they're doing treatment, or maybe they're referring people to the health department for treatment.
And I know the health department, you have to be older than 13 to do STI testing and treatment, but it also is completely confidential, and it says free or reduced cost. So if you can't go to your doctor, it's nice to know that there's at least 3 local places in town that will be of great assistance. That's good.
Yes, good resources for sure, and important for people to know.
Yeah. Someone wanted to, I guess I should have asked this earlier, but it was just the overall question. They asked, how do I know when to get tested? And then I guess this kind of goes along with, how often do you get tested for your STIs?
I think we kind of covered that in terms of just what are the recommended screenings, and then any high risk behaviors or change in a sexual partner, or if you have multiple sexual partners, that might change. You might want to get tested more frequently, every 3 months, every 6 months, and not necessarily just for gonorrhea and chlamydia, but HIV. We didn't talk about syphilis. I don't think we've mentioned syphilis. But that would be one I definitely, if I have a patient who comes in and they've had a new sexual partner and they didn't use protection and they want to be screened, I always include syphilis, because the syphilis cases are actually increasing, I think, nationwide and also in Indiana. So that's one that sort of based on kind of our demographics would be something that we would want to include. And again, that can be something that has long-term serious health consequences that you may not have any symptoms right away. But it can be really devastating if not treated. So I always kind of try to make sure people remember that one. And hepatitis B I'll often include too.
Yeah. And I know syphilis, this is totally going off topic from where I was earlier, but isn't syphilis, you have these 2 like kind of benign symptoms of like a rash, and then a couple years later, all of a sudden is when you're in the final stage, and that's where things start to go downhill. Is that how?
I think a presenting symptom definitely can be a rash. I've actually never, I don't think I've ever I have diagnosed someone with syphilis on a screening. I don't even think they were having symptoms, but I haven't diagnosed anyone based on early symptoms. I don't know if Dr. Hartwell, if you have, but I do think a rash can be, or no symptoms is my understanding as well. So
there's primary, secondary, tertiary. So that's probably what you're thinking about.
An ulcer, a rash, or a genital ulcer could be syphilis as well. I would have to, I probably couldn't give you all of like the specific organ systems that could be affected, but I know late term neurologic effects can happen. I mean, it has real psychiatric. So yeah, important to remember that one and get screened. It is a blood test. Like HIV is a blood test. That's something to remember.
Okay. I mean, that does it for my questions from listeners. Are there any final pieces of advice or information that you guys want to tell East High School or whoever else is listening?
I would definitely, I think Dr. Hale commented on this earlier, is, please be comfortable with your provider. Try to feel comfortable asking us anything. And when we ask your parent to step out of the room, please don't, please embrace that, right? And don't try to say, oh no, she can stay. Because I think a lot of that, I think the child worries if they send the parent out that there must be something scary they want to talk about. And so we try to normalize that as much as possible by, okay, I'm going to have your mom step out now, rather than asking. But sometimes there's that little like, the parent will kind of say like, do you really want me to go, to the parent, to the child? And I say, this is how you become an independent adult, right? Is that you take care of yourself, and you ask those hard questions to your provider when you can, and not having your parent there is probably going to make that easier. So please embrace that one-on-one time with your provider, to get to know your provider well enough that you feel comfortable telling those things, because I can't take the best care of you if you're not honest with me. So that's my main takeaway for most of my teens that come.
Yeah, I was going to say, a very similar thing as we're both primary care doctors, so you kind of are getting kind of our perspective here, but I think having a relationship with a primary care doctor who you know and trust is really, really important. And studies show that people who are engaged in a long-term relationship with, primary care they trust, they have better health. So I do think that's important, but I also do understand what it's like to be a teenager and to be scared and to, sort of feel like you don't, you're nervous, you don't know or feel comfortable talking to someone. So like we just said, one takeaway would be know your resources, and there are lots of local resources. But we hope you'll come to us first because we're here for you.
Do you have any questions for me at all? I know I talked at you guys a lot. I'm so sorry.
No, I was really interested in learning a little bit more. I know a little bit about OWL and the curriculum, and I don't know if Dr. Hartwell caught the beginning, but maybe but you could maybe kind of provide a little bit more background about how you got involved and what that program entails.
So as I was saying, I've mentioned this earlier, but I honestly, my mom just kind of approached me, and I think it was actually my friend's mom who found it and then kind of went to all of like my age group's parents, and they kind of just signed up like 4 or 5 of my friends. So it took place at the Unitarian Church a little bit past, heading out towards Grandview. It was completely secular. So it didn't have any religious ties. It just took place there. But we'd go once a week for about an hour and a half. And it was, we all like got to know each other really well. It was the age group. I think it was from anywhere like 6th grade to 9th graders, but most of it was middle schoolers. And we got a whole binder, and it went through topics. Like we started out with relationships and we talked about consent, and it wasn't just like romantic relationships. It had to do with friends, family, and romantic partners. And then we slowly, like, we kind of built up to the more heavy duty information. Like, I know we did 2 lock-ins, and we did like it sounds so silly talking about it now, but we did relay races with condoms on bananas, and like we learned about we had a panel of people who were non-binary come in and talk to us about their experiences to learn about different kind of identities and sexualities. And I thought it was a really awesome way to introduce kids to more medically accurate and informative sexuality information, rather than having it be necessarily like the state's standard, because Indiana is not the most progressive when it comes to information and medically accurate stuff. So I thought, well, if if I'm one of very few people who got to see this whole other side of like how to take care of yourself as a basic function of being a human, I want, how much information is everyone else really missing out on? So I seized the opportunity to talk about this sensitive topic as much as I could, and on as large of a platform as I could at this point in time. But I'm really excited. I hope I get some people to actually listen and maybe even check out. I know OWL does programs for older students in high school, and they also do secular programs if that's something, or they do religious activities if that's something that people prefer. And I know they even do classes, like younger classes, to teach about like boundaries and consent and all that stuff. But I think it's a great program. I have like nothing bad to say about it. For my senior paper, I spoke to the national director of OWL, Melanie Davis, Dr. Melanie Davis, and it's great because she's so active in it, and she's always like updating. Like, even I took OWL just 5 years ago, I think, and now it's way more inclusive with non-binary and different identities and sexualities, and I think that's so important because everything's changing nowadays. But yeah, I know I just talked for so long. I'm so sorry.
No, I'm glad you did. Someone
This
listening, you could have
great.
just made a huge difference in their life.
No, thank
You know, somebody may be scared, not know where to get answers, not know where to get medically accurate information, and you just provided that. So I think it's great that you have the confidence to tackle this sensitive subject. It's important.
Thank you
And
so
very much.
yeah, I was happy to be included and hope that I've been helpful. And I want to say thank you to Dr. Hartwell.
Yeah, thank you so
because
much.
she has a little bit more experience kind of with this age group than I do. But yeah, I enjoyed talking with both of you.
Thank you very much. You guys too.
Yeah.
I can't thank you guys enough. Thank you.
I would say that if Rachel Reed, who's one of the GYNs in town, and myself had our way, we would have a totally different curriculum in the high schools for sex ed or middle school. Right? It's just ridiculous. She told me she's offered to go in and give more medical factual, and the school wants to stick with the abstinence programming. So it's just sad because that's not good.
Well, I talked to my principal and I said, hey, like I was originally planning on doing a resource guide of some type, or like having it be optional. And I knew I would have to I knew I'd have to get involved with parents in some way and make some sort of like permission slip. But my principal was just like, no, like nothing. And I know Sunny has been she's gone to the school board and she's like fought with them for a while trying to get my mentor. She's been trying to advocate for more comprehensive sex ed, but it's just not at that point yet, and it's really sad. It's really disappointing.
Is that a school board decision? Is that who you would have to get approval from the school board? I never have investigated that, but I assume it's the school board that has to approve the change.
Sunny made it seem like my friend who did OWL with me, his dad is on the school board, and he knows Sunny pretty well, so she's like, there's some hope, because
we just got to change our school board. Right?
Yeah,
we got to get some more progressive people on that school board to say this is important to us and our community. But it's small steps.
teens deserve to have access to medically accurate information, and you know what I mean? It's just, otherwise they're going to turn somewhere else. Right. I mean, we need to, I think it's really important. So I'm really glad you're taking this initiative. And I think Dr. Rita's actually would be a great resource too in the future. She would be like the fourth box on the Zoom call that maybe we should have thought of. She would have been really helpful. But yeah, again, I think there are resources, you just have to find them. So I hope this has been at least one resource that we can provide to give some good factual medical information for teens.
All right.
Yeah. And if you have any follow-up stuff after you kind of do your project and there are follow-up questions or areas that we didn't quite touch on that you and want to send an email, feel free. I'm happy to help anytime.
Me too.
And even with the next seniors project, right? We're going to try to build on this.
I know I've got to like adopt someone and try and get them to continue whatever I'm doing.
Keep the momentum going.
Exactly.
Yeah.
Well, thank you.
Great work. We appreciate your time.
Thank you so much
for doing this. Bye.
Bye.
Thank you. Bye.